Bismillah ar-Rahman ar-Rahim. We will start with the first case in communication, which is the most common case in communication in the last 2 years, which is dealing with angry patient. How to deal with angry patient, how to discuss your scenario, how to get the full marks while you are dealing with angry patient. How to go out the station without any confrontation, without harm the patient, without getting angry, and to trying to satisfy your patient. As we said, it is the most common scenario in the last 2 years, so it's important to practice it very well. Nevertheless, we practice it daily with most of our patients, but in PACES it has special composition for the scenario, like what we take in the communication bullet. You have to doing or compose your own lyrics to be aware of what you are discussing in the communication scenario in PACES. Actually, there are a lot of scenarios that present in dealing with angry patient scenarios. One of the most common is wrong injection or wrong medication, and the patient had complication after that, or died, and you discuss the issue with a relative. Or the patient is unhappy because of the bad practice from the medical staff, from the nurse. They just don't like him to get out to smoke, or from transferring from department to another department, or from a late diagnosis, and this one is common also. Or a patient on long-term treatment, like patient taking methotrexate or patient taking amiodarone and had a complication. How to deal with such patient, how to tell him that the medication that we had started since a long time ago, it was the first option for him and it was really beneficial for him, and discuss how did you start and what happened while you was starting with the medication itself, and who discussed the medication itself with you. Or the patient may take the medication and his doctor prescribe another medication causing side effects, like patient taking, for example, taking methotrexate 2, and his doctor prescribe for him or prescribe for her nitrofurantoin, which has problem, or both causing a problem on the folic acid, causing a lot of complication and side effects from using both medication together, methotrexate and nitrofurantoin. Or patient for a second time chest tube, and this is one is a common scenario also. Patient for a second time chest tube, as the first time chest tube failed or causing him complications. So the 5 main common scenario: wrong injection and the patient had a complication or died; unhappy patient because of bad practice from the medical staff, nurses, or have been transferred all the time, or a late diagnosis for his disease; a patient on long-term treatment and had a complication from the long treatment itself; or patient taking a long treatment medication and one of the doctor prescribed him another medication, causing interaction with the long used medication, causing a problem for him. Or patient for a second time chest tube, as the first time was failed or causing a complication for him. We should know the difference between the medical mistake and the medical negligence. First of all, do not ever say to the patient or tell the patient, it's a medical negligence. Do not ever say this word. You may say it's a medical mistake, it's a bad communication, I don't know what exactly happened, but never say it's a negligence. Always say it's a mistake, just a mistake. So medical mistake, the problem has occurred, but there is no complication. The problem has occurred, the patient takes the penicillin injection, but no rash appear, no side effects appear on the patient. But the medical negligence, the patient takes the medication or the mistake occurred and the complication also occurred, like a patient take penicillin and he got allergy. As we said, do not ever say it is a medical negligence. You may say it's a miscommunication, it's a bad communication between the medical staff, it's a mistake and apologize for that. Or say, I don't know what exactly happened, but I will go back through your file to find it or to know what exactly happened with you. One of the most important advices during dealing with angry patient: do not ever raise the complaint issue. What I mean, do not tell him that if you wanted to make a complaint, I will advise you. No, if the patient didn't tell you he wanted to complain or he wanted to make a complaint, never tell the patient that if you wanted to make a complaint. If the patient raised that issue, it's okay, just to go through with it. But if the patient did not ask for a complaint, do not advise him. So if he tell you he wanted to make a complaint, then you will advise him to go to the higher authority, which is PALS, or the Patient Advisory Liaison Service, the highest authority. Whatever, and then tell the patient, whatever you make the complaint or not, we will do our best to help you and to manage your problem. How to play your role in a scenario with dealing with angry patient. In all the communication scenarios, they have the same composition, so you have to introduce yourself first. I am Dr. Magdi. I am here today to discuss your medical situation, confirm the agenda, and take the consent. Is that okay with you? Yes, doctor, it's okay. Then ask the patient about his health condition. How do you feel right now? Would you tell me how do you feel right now? Does you have any problem right now? Then he will tell you exactly what happened. And then ask the patient about his expectations. What is your expectations regarding your health condition or regarding your father's health condition? Of course, if he is still alive, or if he is still complaining, or if it's written in the scenario, he has bleeding from his nose or rashes on his body. But if he is died or his father passed away, so no need for expectation here. Just to compose your lyrics according to the scenario. In dealing with angry patient, in the first 2 minutes after introduction, you may let the patient to explore himself. Most of the angry patient, as we dealing every day with them, they are always talkative. So do not stop him or her in the first 2 minutes. Let her bring all what she got in her paper or in her pocket to you. Never stop her or him at the beginning of the discussion. Let her tell you everything. Do not stop the patient. Then after that, you have the time to play your role. One of the best thing to calm your patient is to admit that there is a mistake had happened or a problem had occurred, and apologize for that. Say, I'm really sorry for what happened, and I'm really sorry for the bad situations that you are in. And do not make a confrontation. Do not say no problem happened or nothing happened, it's your mistake. No, it's our mistake, and I apologize for that, and I'm really sorry about that, and I wanted to make sure that the consultant had been informed, and the high risk team management is investigating right now about the problems that happened, and an incident report was written. I want to tell you that all the measure to make sure that the problem which occurred will not happen again in the future were taken. So admit, apologize, tell the consultant who was informed about the problem. The high risk team is investigating the problem. The incident report was written. All the measures were taken to avoid what happened, to avoid rehappening in the future, like write the name of the patient in a huge font on their medical record. Actually, they are the patient or the person who interviewing you in the exam was angry. That's why it's dealing with angry patient. You have to control your mind. You have to control yourself. Do not raise your voice. You are in exam. Do not shout. Do not get angry. Try to keep eye contact all over the discussion. Eye contact will calm the patient. Keeping eye contact will calm the patient. Use your body language to support you. After you deal with the patient and with the scenario and admit what happened and say and apologize for what happened and say the proper solution for the problem that occurred, take abbreviated social history, with whom she is living with, who is taking care of her. You can help her at home. What's her job? Can help her at her job if there's a bad infection or if she needs a sick leave. If there is any family history of similar condition or problem, if there is any past medical history of similar condition, hypertension, diabetes. Does she have any drug allergy? Like when he has allergy to penicillin, he might have another allergy to another antibiotic. So you must take the drug allergy or drug history in this case. And smoking to help her, smoking and alcohol too. Then your clinical judgment. What is your specific management plan for this patient? You will admit her, you will not admit her, who the consultant will take care of her, what about the GP, what about the nurse, what about smoking cessation clinic, what about alcohol therapy, what about occupational therapist, what are the investigations you are going to do for her to make sure she is okay right now, or he is okay right now, what is the treatment option for the patient, and the multidisciplinary team. This part is a clinical judgment. Then ask her directly, what is your concern? May I ask you what is your concern? Then answer it directly without hesitating. So relax. Now you have to summarize. Try not to recap an angry patient. Try to summarize what you discuss for the angry patient. Always try to sum up in case of dealing with angry patient to save time and avoid confrontation. Ask her if he or she has any other concern. Then it's time to finalize your case. I will give you my hospital contact number. I will give you brochure, websites, and leaflet to know more about your problem. And may ask you if you have any other concern. Thank you. One of the most common scenarios that occur is that the patient will not be satisfied by your discussion. It's written in his paper not to be satisfied whatever you do for him. So do not angry, just relax. It's a scenario, and try to practice this scenario several times with a real patient. You will find it easy in the exam if you try to practice it on daily practice, even with your colleagues. Now you finished. You make the scenario in a good way. Just relax now. and you have 1 minute now to review yourself. You have to write the case type, the ethical issue in this scenario. You have to write the legal issue in this scenario, about the management plan. That's all for dealing with angry patient, which is the most common scenario that present in PACES exam. And that's it for today, and thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.